We go now to our reporter Laura Windsor, who's on assignment.
Thank you, Roger. Venous disease involves problems that occur in the veins, and the treatment may require vascular surgery. We spoke with Dr. Larissa Lee in the Amputation Prevention Center at Valley Presbyterian Hospital to get answers about venous disease.
There are two parts of vascular surgery. There's the artery and then there's the vein. So the arteries bring the blood from the heart down to the feet or to other parts of the body, and the veins bring the blood back from the feet or anywhere else in the body back to the heart. And in a lot of people, in most people, the venous system is quite normal. But in a lot of people, about 25% of the population actually, people can get venous disorders. It mainly affects the legs in that you can develop swelling, pain, itching, and in the extreme form you can develop ulcers or open wounds of the leg. Some risk factors for this are standing occupation, so patients who stand all the time. There's also hereditary factors, so if it can run in the family. Being female increases your risk quite a bit, being pregnant, and as you get older you tend to develop it as well.
Dr. Lee, how is venous disease diagnosed?
Oftentimes you can see the swelling, especially if they have it on one side of the leg but not the other. They also tend to have prominent varicose veins, so veins that bulge out, and most people can tell that. Sometimes they have very fine spider veins that are almost kind of like a cobweb, a very fine light red cobweb in a lot of patients. And when they come in with these symptoms and their clinical story fits a venous insufficiency or varicose veins, we can do tests. Usually a simple ultrasound can diagnose it.
What are the treatment options for venous disease?
Within the last 10 years or so, we've had technology has advanced so that now we use a minimally invasive treatment where we can use a laser fiber, insert that into the vein, and the heat of the laser fiber causes the vein to collapse. And that's really an office procedure. It takes under an hour or so. Sometimes patients can still have prominent bulging varicose veins after that, or the spider veins may still exist. And for that, what we can do is phlebectomy, where we make little incisions in the leg, physically remove those unsightly veins, or we can do laser therapy on the skin, or sclerotherapy, which is a chemical treatment. Technically, the laser treatment, where we shut down the veins, it has a technical success of about 95%. In 5% of those patients, it may reopen, but it's a simple enough procedure that we can do it again if need be. But most of the patients find a lot of relief in their symptoms. And it's a pretty safe, easy technique that, again, is office-based. So it has a very good success rate.
Dr. Lee tells us about her patient Mike and his case.
So he presented to us several months ago with heart problems as well as an open sore in his leg. At that point, he was in threat of losing his leg. We tried our best, did a heart bypass and did a leg bypass, and in the end, I'm glad to say that we did end up saving his leg.
I was almost losing my foot, and then Dr. Lee taking care of my right foot, and so far right now I'm in good position, and I'm so happy because every day that I wake up and I say, God, I can see the sun today, and I'm getting better and better. So I think it's amazing.
For patients at risk of lower extremity amputation, preserving a limb is critical to preserving their quality of life and independence. For the American Health Journal, I'm Laura Windsor.